So welcome everyone. I'm Dr. Marta Vázquez-Ortiz. I'm a consultant in pediatric allergy at Imperial NHS, and I'm the program director of the allergy postgraduate program at Imperial. So I have a few slides to show you. So I'm just going to share screen and go through the plan for this evening. So I hope this is working and you can see my slides there. Okay, so this is kind of the agenda today. So I'm going to be talking for about 15-20 minutes, going through the postgraduate education offer in allergy at Imperial, the clinical services feeding into the allergy education program, and then the research in allergy and asthma at Imperial. So very much what's going on in allergy and what you could get if you join us for the postgraduate education program. Okay, and then we have one of our students, Fran Cole, who's an allergy specialist nurse here in London, sharing her experience about being in the program, and she's in the second year of the program. And after that, we will have I hope plenty of time for you to ask questions. And for that, you will see in this Zoom webinar, you have an icon that is the Q&A icon, and you can post questions in that little chat. You can post questions anonymously, and most of the questions probably we're going to address verbally in the Q&A at the end. If we see that there are some more admin type questions, you're asking for very specific information that is best to read, say, from the college website, etc., or very specific admin information, my colleagues there in the background will probably just reply to that with useful information. So that's kind of the very basics. Okay, so there was going to be time for questions, and please put any questions in the chat. We have received some questions already in advance, so I have notes of that, and we're going to try and address those as well for those who send those beforehand or are going to be kind of watching the recording later on. Okay, so what can you expect if you join the allergy postgraduate certificate or diploma or MSc with us? Okay, so I think the bottom line is, whether you want to become an expert in allergy. And if the answer is yes, I think you will be in the best place for that. So to become an expert within your career ambition, within your career sort of aims, is really going to make a difference in your career, take you to the very next level. So why Imperial? We know there are other institutions offering allergy education. Imperial is top 6 university worldwide, which is a pretty big thing. And I think that, of course, comes with the talent of the faculty, but also with the talent of the students. And I wouldn't want you to see that as kind of pressure or competition, because it's very much not the atmosphere we are in. I think the faculty, I think it's fair to say we're open, we're approachable, we're friendly, and we really have a passion for what we do, in this case, allergy and asthma. And we really like welcoming students who are very passionate about what they do as well, and share experience and learn from each other. So it's very much the talent, meet very sort of like-minded people within the faculty, within your student community there. And it's also about the fantastic resources we have in such an institution. And that can be great resources, say, at the library, at the Centre of Academic English, and a wide range of resources that we signpost you to, and that you can take advantage of during your time with us. You can see that Imperial has been rated as best university in the UK in terms of research, University of the Year within the UK, etc. So very much an outstanding institution with world-class recognition. And then when it comes to allergy, we kind of like to say that Imperial is the home of allergy, and is very much one of the places where really allergy started and has developed as a scientific specialty, and is very much here, specifically at St. Mary's Hospital, where we're based, where the first allergen-specific immunotherapy was developed over 100 years ago with Noonan Freeman, and is also where Dr. Bill Frankland, the grandfather of allergy, has, how he's called in the UK, developed one of the biggest allergy services in the country and in the world, where he did the first trial on allergen-specific immunotherapy and rolled that out really as clinical practice. He also started the first pollen count in the rooftop of the hospital. This is very much like the beating heart of allergy, very much kind of from kind of many years ago. And then other figures over the years, like Professor Barry Kay, who really did outstanding contributions to our understanding of the mechanisms underpinning asthma that has then paved the way to very effective treatments such as biologics. And that over the years has evolved to having really fantastic research body in allergy and asthma in what is NHLI and Imperial, and we very much rate second in the world for allergy research after Harvard. So very, very interesting things happening there in research. And that tradition in really outstanding research and educational clinical practice is what allows us to have world-class teaching these days. And I think the key strength of the program is our fantastic faculty. And you see many of these people there in the pictures. You probably recognize quite a few of them if you've been in the allergy world for some time. Many of them are real sort of world-leading experts in a number of fields. So you see there Professor Steve Durham or Mo Samji, leaders in immunotherapy, Adnan Kustovic, Sejal Saglani, Andy Bosch, Louise Fleming Key, leaders in allergy, in asthma, and then people like Paul Tana or Bob Boyle doing really interesting research in food allergy and anaphylaxis, and then academic dietitians like Roseanne Mayer, Isabel Skippela, and myself. I have also an interest in food allergy and particularly FPIES. So that together with the international links we have allows us to have kind of the best experts in all the different fields and have really a very extensive, comprehensive syllabus, very much with a holistic view of the specialty. And over the years, we have evolved to have a very student-centered active learning program, lots of learning by doing, learning practical skills that are going to be really helpful in your professional career, if you're a clinician, but also if you want to be a researcher or you want to work in industry, etc. And it's very much a flexible program with very much an international and global atmosphere. And now we offer both the online stream, so you can follow the full program online, or you might choose to join the blended stream, which includes online teaching as well as some on-campus teaching, as we will see. So what about our students? So I think, we're very lucky. We have amazing students, and, it's really, really lovely. And again, I don't perceive much in terms of competition. You really see like very mature, very clever and highly motivated students who look after each other and support each other very much, and it's an absolute pleasure to work with them, really. So we have quite a few healthcare professionals, not only doctors from different specialties such as pediatrics, GPs, and different specialties such as dermatology, chest, ENT, or gastro, but also specialist nurses like Fran, dietitians, pharmacists, etc., but also people without a healthcare professional background, without a clinical background, like biomedical scientists or people from other specialties, people working in industry or willing to work in industry, or entrepreneurs, where they see, allergy is a big sort of evolving field where there's quite a lot of opportunity. Okay, and want to have like the best education. So if you want to see a bit more about our students, there's some links there, and you might want to read some of their bios and what they've done after doing the masters. So in the last 5 years, we have had students from all over the world, about 50% from the UK, about 25 from the European Union or Ireland, and then about 25 overseas. I think we're seeing the overseas increase at least over the last sort of 1-2 years. And you see a broad range of countries, which is really, really interesting, because probably doesn't happen with other specialties, but allergy, of course, presents differently in different parts of the world because the environment is different and probably, the genetics are different. So we really like to hear and capture all that diversity, and that very much comes from having a very diverse and international student cohort as well as faculty. So now I'm going to talk a bit more about the program. So what's the structure of the program? So we are a part-time program. And again, you can join as purely an online student or as a blended, say, student doing some online and some on-campus stuff. Okay, so everybody starts with doing year one, which is these 3 modules, is 10 credits each. So they're kind of slightly big modules. So the first module is the scientific basis of allergy. So this is very much the immunology and the mechanisms underpinning allergy. And that's really important to then understand how things present in clinic and how diagnosis works and how treatments work or might not work. So it's very much the basis to, to then build on everything else. Then we move to the second module, the diagnosis and treatment of allergic disease, which is a very clinical, very practical module where we go through the different disease areas, how to diagnose, how to treat based on sort of best evidence and current guidelines, and also the knowledge gaps and the controversies. And then we finish off the first year with the cutting edge of allergy, which is very much about what's new in research in the specialty, with impact in clinical practice, with need for more research. And also that's the module where we start helping you develop research skills to do your own projects and start thinking about, say, your MSc project or your own clinical project. Or research projects in your own environment. And a few students decide to exit at that level. Most people continue with us. I will say over 90% of students continue with us. But if you exit at that point, that will be a postgraduate certificate in allergy. That's 9 months, which is 1 academic year. Okay. Again, most students progress and complete at least the second year modules in addition to the first year modules. So what do we do in year 2? So we do specific disease areas in kind of much more detail. So food hypersensitivity, rhinitis, rhinosinusitis and immunotherapy, asthma and allergic airway disease, allergic skin disease, where we also cover quite a bit of drug allergy, and then pediatric allergy. And in all these modules, is again very holistic, very much, with a clinical focus, very much reflecting what's new in research, what are the knowledge gaps, what are the controversies, what's needed in the specialty. And we focus very much on more complex scenarios, complex kind of diagnostic workups, complex decisions around management, very much with a multidisciplinary approach, and really recognizing the role of the different specialties and professionals involved in delivering very good allergy care. And then quite a few of our students, I will say at least 50%, complete their research project. That can be done within year 2 or as a standalone year 3, doing the research project and complete the full MSc. Okay, so this is the structure there. And then how do we deliver the teaching? So again, blended or online, the principles are very much the same, and the 2 cohorts or the 2 streams very much coexist, and we try and build as much as we can a single cohort where we can, learn from one another. So for both cohorts, of both streams, there is a part of the content that is delivered asynchronously. That means you access that content in your own time, and it's online content, and that includes a range of things like lectures and mini lectures with experts, interviews, podcasts, practical demonstrations of simulation training, more on clinical and practical things, reading lists of key papers. So it's a really nice selection of the key papers for you to read, some other good quality web-based resources, quite a few interactive exercises for you to practice, and then some tasks that, a lot of that is voluntary, not mandatory, but we then pick up on those tasks in many of the live sessions for discussion. So you have a bit of time to prepare beforehand if you want to. So that's the asynchronous, what you do in your own time. And then the synchronous element is when we come together for live teaching. And that can be purely online for the people in the online stream, or can be partly online, partly on campus, okay? And when we have like part of the people online and part on campus, that's what we call a hybrid teaching day. And you will see some pictures later on. So what do we do in the live session? So it's very much for interaction, okay? It's not, to give a lecture like back in the day. It's very much for you to talk, come with your questions, come with your challenges, with your cases, etc., and to have focused discussions, quite a lot of group work. We do workshops, role play, simulation, and students get to do a lot of, little presentations and work where you're really developing really important skills for your career. So things like Procon debates, presentations, journal clubs, etc. And those coming on campus do hands-on practical sessions as well. That for the online stream, we have covered with interactive exercises and practical demos online. So how does that work? Say if you think about a single module. So basically what we do is we launch the module on a particular date, say on week 1, and we make pretty much all the asynchronous content available on that day. So you can access that from then. And we present, say, the module, with a very sort of clear structure, clear plan. We release the live timetables so you can plan in detail, okay? And then about 2 weeks later, we do a first warm-up webinar where there might be some Q&A, some focus discussions, some group work, etc. And then about 2-3 weeks later, we tend to have the main teaching week, where usually on the Monday, the Tuesday, we do live online teaching. And then on the Thursday or the Friday, we have the hybrid teaching. So people coming on campus or following online based on their stream. And then about 4 weeks later, we have the main assessment for that module. So you have time to go through the materials, again, prepare for your assessment, okay? So that's kind of how the teaching is delivered. What assessments are you gonna find if you join? And this is very much covering PGCERT, PGD, PMSC. So you're gonna have written exam, you're gonna have case reports, so how to write a case report, which, should help you if you then see really interesting cases to really publish them. How to run a mock allergy clinic is another assessment, writing a research grant application, presenting a poster on a case, doing an oral presentation, a complex case group presentation, a patient information event, a review paper, a case-based quiz, and then if you do the MSc, your thesis, which is an original article format or a systematic review format that is very much ready then for publication. And many of our students go then and publish their work because it's really good quality. So this is just some examples of how the learning materials look like. So this is the asynchronous materials. So we like to structure most of the asynchronous or all the asynchronous content of a module in a busy kind of colorful table, with the different themes within the module. So this is diagnosis and treatment of allergic disease module. And then you can go there and go through your different topics and choose, what you want to watch. And that's when you find things like this, like a nice sort of interface. And then you kind of want to watch your mini lectures on controversies and advances in anaphylaxis, for instance, or the role of physiotherapy in asthma. Okay, so that's your asynchronous part of your asynchronous content, but there's much more to that. So there's quite a few sort of interactive exercises like anaphylaxis theme scenarios where, you're presented with cases and videos and then questions and key resources to read and learn, consultations, cases, quizzes, interactive diagrams, so kind of a range of things, practical demos, as I was saying. So this is kind of one of my colleagues showing lots of different creams for eczema, and then virtual tours in the lab. So this is more Samchi in his lab, and say, our clinical research facility or a food challenge facility with one of our senior research nurses. So lots to see, to really get the experience as if you were there. And it's been all very sort of, well thought, to maximize your learning. So if you were to spend some time with us observing, you probably need weeks and weeks to really see all the complexities and the richness that we put together with all these exercises. So this is how it looks when we get together for online teaching, where everybody's online. So it's very much an MS Teams meeting, and we get very chatty, lots of kind of, hands up and talking and chat use and Mentimeter use, etc. And this is how the hybrid days look like. So this is like France cohort. So this is kind of in the spring, this past academic year. So where we have some people, in the blended streams joining on campus, and then the online stream joining remotely. And we very much sort of do hybrid teaching, and it's really working very, very well. So these are some of the things our students do, like fancy diagrams with immunology stuff, but also lots of more clinical and practical stuff. And generally, we get really lovely feedback about the modules. We, of course, gather formal feedback in a survey format that we look in a lot of detail, and we're constantly looking at, what works well, what can be improved, and we kind of constantly sort of rethinking and trying to make things better. So this is how some of the on-campus practical things look like. So this is things that we do with a blended stream. So things like, again, anaphylaxis sim with our patients or our adult, trying lots of different eczema creams, doing nose endoscopy, doing skin testing, and doing some food challenges and trying kind of placebos and blinded stuff there. So it's very, very lively. And just moving on, changing topic completely, this is about the fees, okay? And, I always find this is kind of, I cannot say off the record, of course, but, the information in the website might not be very, very easy to understand. So that's why, I like to kind of put things in a table there. So for home students, and that's UK students and students from Ireland, the fees are the same for the online and the blended stream. And over the years, people have generally joined for the PG Cert, and you pay the PG Cert fee. And then as you progress into the second year and then the third year, you pay the top-up fee. If you have questions about that, I'm sure my colleagues can help in the chat there. Okay, so this is home fees. And then overseas fees, we don't have the figures for this coming academic year for the online stream, seeing that the fees for the other bits haven't changed much from last year. I'm not expecting big changes, but you see the fees for the online stream for overseas students are in blue because this is last year fees. So we're hoping things are not going to change much. And then the blended stream fees are kind of higher. And you see it's the same principle. Okay, great. So funding opportunities, we get lots of questions about that. So we've offered scholarships over the last few years. One of the scholarships, we know it's fully approved. That's a scholarship from a family trust that very generously is sponsoring a student this year and will sponsor a student next year, covering what is equivalent to 50% of the home fees for the full MSc, okay? And that's open for anyone, overseas student or a home student, online or blended. And then the other smaller scholarships, I'm waiting for confirmation, but hopefully we'll hear soon. And I'm hoping to open for scholarships applications early next year. The deadline is usually mid-July, so we're gonna go for the 15th of July this coming year. And, we will circulate the information on the website, etc. So career opportunities. So what to expect, if you join the program, where to go from there. So as I said, many of our students are clinical and are coming very much with a vocational sort of interest. They want to do better for their patients and grow within their teams or beyond in a kind of leading position often. And this is very much what we see. We see either doctors or nurses or dietitians going into senior roles within their team or moving hospitals and working in a more specialized environment. GPs developing an interest within their practice, and quite a few people also developing some private practice, as you see, because there's a lot of need and demand for allergy. Research opportunities as well, to go and do an MD or a PhD, and then potentially continue with a research career as a principal investigator. And again, the MSc or the program will give you really the latest, what is known, what is the absolute latest, what are the needs, what are the gaps. And that really, gives you absolutely valuable knowledge to decide, which way to go within the field you like. And then it could be job opportunities or career progression opportunities within research. So we have students who've gone into a lead allergy research nurse role or a senior research fellow, or people working in industry, more in research within industry, or also job opportunities in industry. And we have students who are now in sort of dealing with kind of clinical research roles, again, within industry or medical advisory or senior positions in industry. So I'm going to talk very briefly about the clinical services. I think one of the key strengths is that we really encompass many of our faculty, and particularly the module leads, with very much clinical academics. So we have one foot in clinic, very much down to earth. and 1 foot in academia, in research and education. And that really transpires. So we basically have teams working across what is Imperial NHS, which captures a number of hospitals in London, and teams at the Brompton Hospital. And that captures allergy and pediatric allergy, respiratory medicine, both in pediatrics and adults, dermatology, gastroenterology, ENT, and other specialties that say feed into allergy. So if you look at this, silly map of London, we're very, very central, based mainly in Paddington and South Kensington, so very, very central. And just to give you a bit of a very brief overview of what, say, the pediatric allergy service where it looks like. So we're one of the biggest, largest tertiary referral centers in Europe. We're very much a multidisciplinary team where everyone is equally important. We have, specialist nurses, dietitians, speech and language psychologists. We have very strong links with a number of specialties where we do joint clinics. We see over 6,000 kids a year with a whole spectrum of allergic diseases. And we have a focused interest in complex patients, holistic care, and patients' education. We are a training center for Greek trainees and Spain trainees, and we regularly have international fellows. We are the lead center for Northwest London for allergy, and it's very much evidence-based practice and bringing translational research into the clinic with very, very strong links with the clinical research facility at Imperial that my colleague Paul Turner leads on. So we very much have sort of fingers in all places there, and you can see lots of people there in the picture. So this is in a nutshell what the Brompton team, the pediatric respiratory team, does in relation to asthma, more encompassing again clinical practice and research. So they have a focused interest in problematic severe asthma and teasing out what's difficult asthma, where there are modifiable factors that you need to tackle with behavioral change. And that's where their model of multidisciplinary care involving all these parties is absolutely key, and they're extremely good. And again, they bring this to the education program, and then research in this area into biomarkers, into phenotyping, and then targeted therapies through a range of initiatives in research, and they're extremely strong on all of this. And now, in a nutshell, research, what's going on in research at Imperial. So I said, we're kind of second in the world. So it's all pretty amazing. Okay, and we very much capture from clinical research, wet lab, as well as dry lab, and very much taking advantage of very powerful machine learning strategies that, are very strong within the team to make sense of complex data and really provide new insights and new understanding into different aspects such as mechanistics, disease phenotypes, epidemiology, etc. So we have clinical data, say from birth cohorts, patient cohorts, RCTs, animal data, and we do very careful phenotyping, looking into sort of diagnostic clinical characteristics, mechanistics, etc., and then a number of intervention trials as well. So key areas, we're particularly interested in mechanisms of immune tolerance, anaphylaxis, and other forms of food allergies, such as FBIs, that I lead on, endotype discovery and diagnostics, again, mainly related to asthma, but also anaphylaxis, primary prevention of allergic diseases, environmental control interventions, and allergen immunotherapy, both inhalants and food immunotherapy as well. And you see lots of people there. So people like Steve Durham and more, who've done amazing research over decades on immunotherapy and mechanisms, us doing food allergy and anaphylaxis research, my colleague Claudia, together with other colleagues, doing research on eczema and primary prevention, the team doing asthma research and epidemiology, and the team from Adnan and other colleagues with very kind of strong bioinformatics teams making sense of complex data. So this is, what you will have access to, and we offer research projects for our students. So, that's a great opportunity to kind of have a foot in research at Imperial, but also, to kind of knock on people's door and say, I'm really interested in this topic. I would love to do a project with you. And we're always up for collaboration with interested and talented students. So this is all from me. So I hope that was interesting. And now I'm going to stop sharing and I'm going to move on to having a chat with Fran, one of our students. Okay. Fran, are you with us? Because, with this webinar thing, you cannot see anybody unless, it's our panelists. Okay.
Hi,
Lovely.
Marta.
Great, Fran. I'm not sure if people can see you. I cannot see you.
Yeah, when I put the start video, it says it's been disabled by the host. So I don't know if that's able to be done. I don't know.
That's a shame. So
Sorry.
I'm sure my colleagues in the background must be trying to sort that out. We would love to kind of see your face.
Yeah.
Okay, Fran, do you want to tell us a bit about yourself? What's your background before we start chatting about the program and how you're finding things?
Yeah, absolutely. So, I'm Fran, and as Marta said, I'm one of the children's allergy nurses at the Royal London Hospital in Whitechapel, which is a big tertiary level service. And I've been an allergy nurse here for about 10 years, I would say. So I feel like this has come at a good time in my career to kind of cement all the things that I've learned in practice and get all the theory and deeper knowledge base behind everything that I've been doing over those last years.
Right. So I guess my first question is, why did you choose to study with us? And I see you were kind of answering that a little bit, probably.
Yeah, absolutely. So having worked in allergy for a long time, and it had definitely been on my radar for a while. And I think with everything that happened during COVID, I definitely wanted a new challenge, and I felt like this was a good time. And Imperial College, with the reputation that it has, and came on recommendation from a lot of other allergy colleagues, so I feel like that was the right place for me to do it as well. I feel like the course covers aspects that I don't necessarily get involved in my day-to-day work. So I do pediatrics, and it's good that it covers obviously adult allergy, more in-depth on asthma, which I don't get involved with so much now. I did in my early career, but not so much now. So it's definitely helped with that, and just to advance my knowledge base.
Yeah. And how are you finding the teaching delivery? And you're part of the blended stream, so you do parts of the teaching online and part on campus.
Yeah, so it's been great. So the online material has been great. There's lots of interactive sessions. You can obviously fit it around your own time, your work life, and your commitments. You get assigned teams that you complete tasks with, and that has been great because you build a support network from quite early on. And because everyone's from different backgrounds, so in my team there is hi everyone, you can see me now. So in my team we've got an ENT registrar, I've got a GP, I've got a peds consultant, and we've got a dietitian. So it's a real nice MDT approach to all of the tasks, which has been great, and I feel like we all bring something to the table, so it's been great.
That's great. And how are you finding balancing studying whilst you work and probably have other family commitments and personal commitments, which is, the reality for many of our students?
Yeah, so I've got 2 children at home, and they're both at school, so I think that's another reason why it was a good time for me. I do work part-time, although 3 long days a week, so it does enable me to fit it around my work commitments, and I don't do shifts, which makes life a little bit easier. But however, like, the content is available when you're available, so you can watch little snippets as and when you need to, and then you just obviously need to be organized in advance of when the online and the on-campus things are going to be happening. So yeah, it's accessible, and although it's stressful, and for me personally, I haven't studied for a long time, it had been a good chunk of time. So when I first started the course, that was the biggest thing for me, was adjusting to going back to studying, and how technology has changed in that time. But once you're over that, then it's great.
And how are the academics in the course?
Oh.
Now that I'm not listening.
Yeah. Do you know, everyone has been so lovely, approachable. excellent communication, happy to answer questions. It can get quite lively in some of the sessions. It's some nice healthy debate, which is encouraged. I would say, like, it's nice. I don't know if our group is similar to other groups, but they're definitely an interactive group, and we're all happy to say our own thing, and I think that helps, and the academics are there to kind of facilitate that, and it's been great.
Yeah. And how are the other students in the course?
So the other students, it's nice because you have the online students join in from all over, but they still feel part of our student community. And whenever we have a little break from each other, I know when we met up for this second year, it was so nice to see everybody again. It was real nice to see everyone again on campus. So the students are just your support network where you can offload your worries and all support each other and get through it all together. We're all going through the same thing. So the students have been great, really good.
Would you recommend the course?
Yes, absolutely. So I think I've looked into this course over the years so many times, and I don't feel like it was the right time in my life. I do feel like this was the right time. I've learned so much in the last year, and starting this second year, I can see still so much more to learn, and it's definitely helped with my with my families and things. I think sometimes they're like, I wish you'd shut up, because I feel like I've got so much more to say to the families, because I know so much more that I just kind of want to share it with everyone else. And that's the same, not just for my families, but other members in my team. I'm trying to pass on the knowledge to them as well. So I would definitely recommend the course. Yeah,
that's lovely. And one of the questions we got from one of the people registering was very much, as a nurse, how do you find this course, particularly as a nurse, and how can help a nurse develop herself or themselves in their careers?
It's so as a nurse as well, there's one other nurse on the course. It does feel quite daunting coming into it, because there's a lot of clinicians, consultants, pediatricians. You can feel a little bit like you've got imposter syndrome, but you do have a lot to share and a lot to bring. Like, having done allergy for a long time, there's a lot that you can share as well. From a career development point of view, from a nurse point of view, I'm struggling a little bit with that, because there's not always the career development available to nurses as there are for others. But I think if you're already in a band 7 CNS role, I think from doing the course, obviously cements your knowledge, so there's more chance of potentially either nurse consultant or nurse lead within your allergy team. So there is the development there. It's just not as clear a career pathway as maybe other areas of medicine. But
it's interesting you say that. One of our students this past academic year did her MSc project on the nurses' perspectives, and probably you filled in the survey on the nurses' career path, and we saw that there was so much vocation, so much ambition to do better. But it's true, like, the specialty hasn't evolved to create those opportunities in a kind of structured format, or kind of where you see very clear recognition. But the amazing work is happening out there, so people are taking a lot of responsibility and doing really great work in services and developing lots of different areas within the specialty. So you're definitely making a big difference for services and patients. And hopefully we will push with things like projects and research to influence change as well. So that's been really nice, Fran. So I think we're gonna thank so much for that,
Marta.
I think we're gonna move on to kind of more the Q&A bit. So I'm just gonna open the Q&A, okay? and see what we have. So first question I find there, so are candidates eligible to write the EACI board exam after finishing the program? So thanks, Shireen, for that. So you might know, so the EACI board exam is a separate exam that you kind of register for, etc. I will say the program will put you in a very, very strong position to do very, very well at that exam. And many of us have done it, and many of our students have done it. So, you know, particularly if you're worried about more like immunology questions and mechanisms questions and things like that, you get that covered in the program. So, you know, many of our students do that, and they usually wait until sort of the end of second year to do it. So, definitely encouraged. When will the next course start? And application dates. So applications are open now. The next course is starting in October 2024. So basically, autumn next year. And applications basically close in the summer. Okay, so say if you're an overseas student wanting to join the blended stream, you need a visa, and the very sort of deadline for that is end of July. If you're a home student or an overseas student wanting to join online, that's end of August, okay? But the steps in the application can take a bit of time, so don't leave it, say, to the last month. I will say, you know, if you're interested, apply as soon as you can, because, you know, gathering the sort of the different things to upload, etc., the references can take some time. So I will encourage you to apply as soon as possible. So more questions there. Any specific course available for pediatric allergy? So we have a module that is pediatric allergy, which is the last module in the PG deep year, so in the second year. So it's a bit of an advanced module, really sort of interesting, with quite a lot about sort of complex presentations, differential diagnostics, MDT work, adolescent transition. So kind of building up on things that still need, you know, a bit more sort of development within the program. So yeah, and of course, as children, you know, in allergy is such a big part of allergy, get quite a lot of cover in the program. So we have quite a few students from pediatricians or pediatric nurses like Fran, and they get a lot because a lot relates to pediatrics. There's kind of few things that, you know, are just more like elderly that you're not going to see in pediatrics, but the young adult presentations and other sort of less common presentations in pediatrics that might relate more to adults, that generally also relevant for pediatric people. Okay, so someone saying, I'm desperate to know more about blended allergy asthma course, which is designed for overseas, and considering a fellowship in the UAE. So I guess this is for someone based overseas being interested in the blended program. So blended means you come on campus for some of the teaching. How we structure it is still very feasible for someone based abroad, because you come 3 times in a year for usually 2 consecutive days of teaching. So people kind of travel, attend the teaching, go back home, keep working and doing all the other bits. So blended for someone overseas is feasible. Okay, quite a few overseas students join the online stream, but that's kind of up to you. I think I've covered the questions in the chat. If I haven't, I beg my colleagues to kind of let me know. And we have some other questions that we got from students sort of before joining. I've put them in a slide, so I'm just gonna go back to my little slide. Sorry, I just want to close this so it doesn't look too messy. So these are the other questions we got. So someone asking about scholarships for overseas students. So again, as I said, the scholarship that we have confirmed is the Breeze Family Charitable Trust Scholarship, is open for overseas students. We haven't opened the application process yet, but that will happen early next year. So for these and any other scholarships we might be offering, as in previous years, you need to have started or submitted an application into the program to be eligible. Okay, so you kind of do the 2 things in parallel, but they're open for overseas students. Second question, someone asking if they can enroll with a psychology degree. Short answer is generally yes. Okay, so the set criteria to be eligible if you feel you might not get to the threshold, there is a route that is called the special case route, where people, based on professional experience or interest, might make it in, and basically review the applications. I interview the candidates, and usually it's very, very clear. They have a very clear motivation, and we basically follow process in the college and they get accepted. So definitely we need more psychologists in allergy, so very, very interested to have some psychologists in the course. That question there was the nurses question, so I think we touched on that. Someone asking, does it matter if we work in other trusts that provide similar education, or in other universities? I would say no. You're coming to the best place to study allergy, and I always think, often is very good to get out and see how people think elsewhere, because that gives you a broader understanding of different ways of doing things, the pros and cons, and challenge the dogma, which in allergy I think is very, very important, because there's been lots of dogma over many years and not so much evidence. So definitely, and we're very open, to hearing what other people do and how people do things, and learn from each other and share. So definitely, we have people from all over the world, really. Okay. So someone saying they're an homeopath and interested in applying homeopathy to allergy and developing a research interest. So again, the course will give you an in-depth overview of where things are in allergy, and whether, potentially things like homeopathy can have a role, and how to go about designing a research study in that area. So someone else asking how people from other countries do in the course. So again, we have a very sort of international student cohort with different backgrounds, and generally people do very well in the course. And there's of course a lot of learning materials that help you, a lot of signposting and support, etc. But we also get very talented students, and there's a lot of team support, as Fran was saying, that goes into that. So I don't think you're going to feel lonely, or we don't want you to feel lonely or different. Different is good. Someone else from the sort of UAE as well, practicing pulmonologist, wanting to do a fellowship. So just to be clear, we're not a hands-on fellowship program. So you're not going to come and spend a year with us in the clinical service doing stuff. Okay, that's a different thing. We don't offer that. So the program is very much an academic education program. I think it's going to give you very, very similar skills, and even more advanced, because we, really design what we want to teach. So we have control over the content completely. And it's quite clinically orientated. What we can do, we have observers in the clinical services, linked to the program. And often our students come and spend some time with us in addition, so separate to the program, come and observe with us for some weeks, or it can be up to 3 months. And they kind of complement that with more hands-on, seeing what happens. So that's something that we can discuss with students as well. But it's completely separate, and there's a selection process, etc. And then last question there. So someone from Sydney saying they have a postgraduate certificate from Sydney, and whether previous education counts towards the credits here. So I would say short answer is probably no. Okay, and that's partly because allergy is such a rapidly evolving specialty that, say, something someone might have done 5 or 10 years ago probably is not fully up to date. And the college has very strict rules as to, kind of recognition, etc. So I will anticipate this is probably difficult. And, people generally start from scratch. Okay, so this is the questions I had. And I'm just going to stop sharing again and go back to the Q&A, because that's 2 more. How much face-to-face does the blended course involve? Yeah, so as I said, so it's every term, so 3 times a year, there's either 1 full-on day or 2 pretty full-on days, consecutive days there. So say in the first year, you come once in November, once in January, and once in April, and similar in the second year. Okay, so I haven't calculated the percentage. It's sort of very, very full-on, very much hands-on practice, teamwork, discussions, etc. And then someone else asking, is it mandatory to follow the model trajectory for the MSc you showed earlier, or can you just take some courses from the second year in the first year? Yeah, so you cannot do much mix and match. Okay, so if you're joining the Allergy program, you start year 1, you do the 3 modules, year 2, you do the 5 modules. There's a tiny bit of flexibility, like moving 1 or 2 of the smaller modules from the second year to the third year if you're doing MSc. So you kind of spread the burden and you can do the MSc project in the second year. If the question is if you want to do purely a single module or a couple of modules, that's not joining the program. Some of the modules are available as short course, basically short course. So you just join for that and you get a certificate of attendance and you get access to kind of the material. So, there's a separate sort of little website for that in the college. So if you're interested in that, we can circulate that as well. But I think, the overall experience you get is very different, like doing the whole journey. And as Fran was saying, like within your team, doing lots of tasks and lots of kind of learning by doing, as opposed to just joining for a particular module. I think it's quite different, but that's there. And people are welcome as well. So I think that was it. I'm done with all the questions in the Q&A. Okay, lots of talking. I'm sorry I'm talking so much and I cannot even see people, so it feels awful. Okay, so any final questions, put them in the Q&A. Otherwise, we're going to wrap up and say thank you to everybody. Okay, lovely. So, great. So I don't think I put the Allergy email in the sort of in my slides, but my colleagues can put that in the chat now. So if you have any questions, send us an email to the Allergy PGS email account, and we will get back to you as soon as possible. And again, there are no silly questions. Okay, any questions you might have, very happy to talk to you about any of that. So I see the Allergy email account coming, and we're going to be circulating the video today, and probably there's been some links in the chat. So yeah, just get in touch if you have any more questions. Okay, I'm looking forward to having some of you joining next year. Okay, so thanks so much everyone for joining. Big thank you to Fran for joining and sharing her experience, and thanks to my colleagues in the background, like typing and making sure everything is working fine. So thanks everyone, and have a nice evening.